Okay, so we're diving into some pretty intense stuff today.
Yeah,
Healthcare in the U.S.
it's a big one.
It is, especially with all these crazy headlines.
Right.
And, I mean, the murder of Brian Thompson, the CEO of United Health Group, that's insane.
Absolutely. That news really shook things up.
It did.
And it adds another layer of complexity to this whole conversation.
It really does.
Yeah.
I mean, where do we even begin?
Well, you've gathered some fascinating sources.
I did try to get a good range of perspective.
You did.
Well,
And it's clear that healthcare costs are a major concern.
Absolutely.
One article even mentions that the average family premium has gone up.
Wait, how much did it say?
A whopping 54% in the last decade.
54%.
Yeah,
Seriously?
Seriously.
No wonder people are freaking out.
I know, right?
I was like, every year it just keeps getting more expensive.
It's a huge burden on families.
And it makes you wonder,
Yeah.
like, are we really getting our money's worth?
That's the big question.
I mean, especially when you look at other developed countries,
Exactly.
they seem to be doing it better and for less.
It's true. The U.S. spends way more on healthcare per person.
Way more.
Almost twice as much.
That's crazy. And we're not even seeing better results.
Nope. Our health outcomes don't seem to reflect that spending.
So where's all that money going?
That's the million-dollar question.
Is it just all going to administrative costs?
Partly, yeah. The system is incredibly complex.
I can imagine.
Lots of paperwork, bureaucracy, it all adds up.
Plus the price of prescription drugs is out of control.
Oh, absolutely. Pharmaceutical companies are a big part of the problem.
It feels like they can just charge whatever they want.
It often feels that way, and there's not enough regulation.
And then there's the cost of specialized treatments.
Yes. New technologies and procedures are amazing.
They are. They can be life-saving.
But they come with a hefty price tag.
Right. And not everyone has access to them.
That brings up another issue.
Healthcare disparities,
Exactly.
people in certain communities,
Especially low-income communities.
they don't have the same access to quality healthcare.
It's a huge problem.
And it's not just about access.
It's about quality, too.
Right. Like, even if they can get to a doctor,
The care they receive might not be as good.
and that's just wrong.
It's a moral issue.
It feels like we've strayed from the idea of healthcare as a human right.
We have, and many of your sources touch on this ethical dimension.
There was this one article that really resonated with me.
Oh, yeah.
It talked about how in Christianity, there's this emphasis on caring for your neighbor.
It's a core principle.
And it made me think, shouldn't healthcare be a reflection of that?
Absolutely. It's about compassion and supporting one another.
But instead, it feels like it's become a business.
It has become increasingly commodified.
And that's where it gets tricky.
Yeah.
Because on one hand, we need innovation
We do. We needed advancements in medicine.
to cure diseases and help people live longer.
Absolutely.
But on the other hand, we can't lose sight of the human element.
Exactly. We can't let profits come before people's well-being.
And that's what makes this whole situation so complex.
It's a delicate balance.
And the recent news about the United Health Group CEO just adds to that.
It really does.
I mean, who knows what's going to happen now?
it could lead to instability in the market.
Or even regulatory changes.
It's hard to say for sure.
But it definitely highlights the fragility of the system.
Yes, and it underscores the need for reform.
So we've talked about costs, disparities, ethics,
We've covered a lot of ground.
but there's one more thing I want to touch on.
Go ahead.
It's this connection between food quality and our health.
Yes, that's a crucial piece of the puzzle.
One of the articles mentioned a study.
A pretty alarming one, actually.
Yeah, it found a direct link between processed foods and certain cancers.
There's a growing body of research on this.
Yeah, honestly, it's a little scary.
It can be, especially considering how prevalent processed foods are.
I mean, I'm guilty of it too.
We all are. It's so convenient and often cheaper.
But we're starting to see the consequences.
Right. And it's not just about feeling sluggish after a fast food meal.
We're talking about serious, long-term health problems.
Chronic diseases, inflammation, the list goes on.
And it's costing us a fortune in healthcare expenses.
Absolutely. Treating these conditions is a huge drain on the system.
So wouldn't it make more sense to focus on prevention?
It's the most logical approach.
Like, if we could improve food quality,
And encourage healthier eating habits.
we could potentially reduce the incidence of these diseases.
And save billions in healthcare costs.
It just seems like common sense.
It does, but it requires a systemic shift
Right, we need changes at the policy level.
to make healthy food more accessible and affordable.
And to educate people about the importance of nutrition.
It's an investment in our future.
And it's not just about government intervention.
It's also about personal responsibility.
Yeah, we have to be mindful of what we're putting into our bodies.
We have the power to make healthier choices.
But it's tough.
It is.
With all
Right.
the marketing and
It's
advertising,
hard to resist the temptation.
especially when you're busy and stressed.
I hear you.
But I think it's a conversation we need to have.
Definitely. We need to be more aware of the connection between food and health.
And the implications for our healthcare system as a whole.
Exactly.
Wow, we've covered a lot today.
We have. It's a dense topic.
So, rising costs, healthcare disparities, the ethical dilemmas,
The influence of food on our well-being.
and the unsettling news of the United Health Group CEO's murder.
It all paints a pretty complex picture.
It does, and it leaves me with a lot to think about.
Me too.
I mean, what can we do as individuals in this massive system?
That's a great question. And while we can't solve everything overnight,
Right.
we can start by taking ownership of our own health.
Making informed choices,
Eating well, exercising,
educating ourselves about the issue.
and advocating for change.
I think that's a good place to leave it for today.
It is. It's a lot to digest.
It is. But hopefully our listeners are feeling empowered
Empowered to make a difference.
and to take control of their own health journey. Thanks for breaking all this down with me.
It's been a great conversation.
And to our listeners, keep asking questions
Keep learning,
and keep pushing for a better healthcare system.
because we all deserve access to quality care.
We do. And until then, we have to do our best to navigate this complex landscape.
Absolutely. And remember, even small changes can have a big impact.
That's a good reminder.
So, take care of yourselves.
And thanks for joining us on this deep dive.
See you next time.